Welcome back. We left off by looking at some of these restorations that are bonded or fused to porcelain. So we have the base metal, noble alloys, which are some gold, but mostly base metal, and then base metal alloys, which are pretty much all base metal. There's a tiny little bit of gold or noble metals in that alloy. When we talk about metals for removing removable prosthetics, we have to cast those alloys as well, and we use these for partial denture frameworks. Base metals most commonly used are those chrome cobalt alloys and the nickel chromium alloys as well. So here on the pictures are just a couple of looks at what the partials look like. So the top one is just the framework itself with no teeth in place, and on the lower picture is when the partial denture is seated in the patient's mouth and it has the teeth in place that are being restored. Soldering is used for many purposes in dentistry. The main use is to join metals together by fusion of a lower fusing alloy. Soldering of selected materials depend on the type of metals that are being soldered. So we have to use something called a flux to be able to kind of glue these metals together. So the flux is a paste or powdered material that's placed on the heated metal surface to remove oxidized areas from the surface before it is soldered together. So it is giving that metal a better ability to come together and join particles. Soldering usually is done to repair a cast restoration. Another means to use metal in dentistry is to have wrought metal alloys, and this type of metal is formed after the metal is already cast. And if you think of wire, that's a wrought metal alloy. These metals are used predominantly in orthodontics as your arch wires and also as brackets and bands. So in the photograph in this slide, you see a fixed lingual retainer that has been adapted to the lingual surfaces of the mandibular lower incisors and has been attached to the linguals of the cuspids to keep those lower teeth from moving around. Endo posts are another metal use in dentistry, so they can be metal or non-metal. Metal are less aesthetic, and the non-metal are sometimes not quite as strong, and that is sometimes a characteristic that the doctor is looking for. So the metal or non-metal dowels or rods placed within the root canal space after root canal treatment is where these posts come in, and then allows the doctor to then build up the crown to secure a restoration to sit upon it. These posts can be classified as active or passive. And a couple of these, you can see that there are little spindles and notches in these. These are called active posts, where they're actually threaded into the root surface. So they're actively sitting inside of the root because of the action of twisting them in place. The other types are called they're passive types of root posts, where they're cemented in place. There is only a bond of the cement that's keeping them in place. There is no mechanical force that does that. Again, a review of the lost wax technique in our casting procedures, but we're going to be looking at the metal in this aspect rather than the wax. The wax pattern, though, is where we begin. So we take a wax pattern that's completed as a replica of the restoration that's carved onto a die to the exact correct anatomical design. Then the wax pattern is attached to a sprue, which is that short hollow pin that allows the molten metal to travel into. The wax pattern is then invested, which is surrounded by an investment type of gypsum. So that really accurate type of gypsum product is poured all around the wax pattern. Then the wax pattern is burned out, heating the mold to eliminate the wax pattern and also expand the mold in a burnout oven. So here we have that crucible that holds all of those wax patterns with its hole pointed downward so the wax can run out. And this is going to be heated to 700 to 800 degrees Fahrenheit for an hour. Then we have our alloy, which is melted at a very high temperature and is forced into the mold by using a centrifugal casting machine. That's where we have that little button of metal heated to liquid. It is spun really quickly in that centrifugal machine, and then it is allowed to travel through the sprue into the area that the wax pattern once occupied. Once the casting has been completed, then we quench the crucible in cool water, and this allows the investment gypsum to disintegrate. And what remains is the gold or the alloy that we spun into that pattern. Next, the casting is removed. It's cleaned in hydrochloric acid and then polished with abrasive wheels, rubber wheels, pumice, Tripoli, and rouge. So all of these things we'll talk about in our next unit called abrasives. We can recycle dental materials, and there is a finite amount of these materials in nature, so we should do our part to recycle them to ensure that we can still find these, but also to allow them to live the life that they should. Gold alloy can be remelted and recycled 2 or 3 times without any barren if an equal amount of new alloy is added to compensate for the loss of its zinc. So we can certainly do that to restorations that are taken out of our patient's mouth and recycle them. We can give them to the patient to recycle, or we can hold on to them and send a whole batch to be recycled. Any gold alloy that can be reused should be and will be reused if it's kept. Noble metals are the same as the gold, so we can separate those out and recycle those. The precaution is that under no circumstances should excess metals from different types or brands be mixed. So each cast restoration will have kind of a recipe card, a content card that accompanies it to let us know what type of restoration was created for the patient. Those should be scanned and kept in their virtual charts so that we can keep those for later reference. Our dental office used to buy us lunches by the amount of money that we got from recycling dental materials, and a couple times we got some pretty nice gift cards and things because of the recycling that we did with the retained gold and silver and other materials that were kept in our tooth jar. In summary, metals play a significant role in restorative dentistry. Metals do have a low solubility if they are soluble at all in the oral cavity, but remember, biocompatibility is terribly important, so we need to be using metals that are low in their tarnish and resistant to corrosion and things so that the soft tissue stays healthy if it's in contact with those dental metals. If you have any questions, please email, call, or text, and I would be happy to answer any of those. Please make sure that you are reading your materials, textbook, and your module to accompany this lecture.